Hey everybody, this is our largest heart model. I'm going to take just a moment and run through some of the major structures on it. We'll start off with the chambers. We have an anterior view of the heart, and I can tell this right away by looking for the apex, or the pointy part of that heart, and that's over on the left side. The other thing that I want to do is I want to look for this big artery, this big red structure, which is running right in between my two ventricles. It's sitting in a sulcus, or a groove. It's filled with fat on the outside of that heart. The sulcus is called the interventricular sulcus because it sits between my two ventricles. So I have my left ventricle here, I have my right ventricle here, and that artery is called the anterior interventricular artery, which makes a lot of sense because it's on the front of the heart and it's between the ventricles. If I move upwards, I can see the two atria. My right atrium sits over here. The smooth part is the atrium, the rough part is actually the auricle. My left atrium is really not visible from an anterior view. What I see is my left auricle, and I would need to go around to the posterior side of this heart, like so, to find my left atrium. So this is my left atrium, pretty easily identifiable if you can find the 4 pulmonary veins going into it. So I have 2 pulmonary veins on this side, and I have 2 pulmonary veins coming in over here from the right. So that makes this chamber, again, my left atrium. And remember that does sit on the posterior side of my heart. So I'm going to flip this back over to the front again. And we're going to direct our attention to the large vessels that are coming out of the top of that heart. Now remember, if you have a lot of heart, you're a very sappy person, you're full of sap. And those vessels from left to right are the superior vena cava. We have the aorta, that's my ascending aorta, my arch of the aorta, and then over here my pulmonary trunk. That pulmonary trunk, we can check it, it's coming out of that right ventricle. Okay, let's open up our heart. Take a look at these chambers from the inside. I've opened the right atrium. I'm going to open my right ventricle, my left ventricle, and my left atrium. Starting over in my right atrium, I notice that there are several things that are going into that right atrium. Again, my superior vena cava. The large hole that I'm seeing down at the very bottom here is the inferior vena cava, and then the smaller hole over here is the opening to the coronary sinus. So those are the 3 veins that drain into the right atrium. Separating my right atrium and my right ventricle, I get my right atrioventricular valve, or tricuspid valve. I see some chordae tendineae, and then those chordae tendineae would attach to the papillary muscles. If I was to close this up, you would see that they would attach. I see my interventricular septum, separating my right ventricle from my left ventricle, which is substantially bigger in terms of the thickness of that wall because it has a greater distance to pump. Swinging back into this right ventricle, I see at the very bottom of my pulmonary trunk the pulmonary valve, or the pulmonary semilunar valve. Okay, looking over on the left side of the heart, that is my left atrium. And again, I can see the 1, 2, 3, 4 pulmonary veins. Yes, they are veins, even though they're red, and that's because they have oxygen-rich blood in them. I see my left ventricle, again with a valve, my left atrioventricular valve, or my mitral or bicuspid valve, attached to some chordae tendineae, which are then attached to the papillary muscles. We can see some more papillary muscles over here in the wall of the heart. Let's identify the layers of the wall on our heart. We have the epicardium, or visceral pericardium. In red, we have our myocardium, and then on the inside is the endocardium. Excellent. Let's look at our other vessels. First of all, this aorta is coming out of the left ventricle, despite the fact that it looks like it's way over here. It goes behind the pulmonary trunk. And if I get in here, there we go, I can see the aortic semilunar valve right in here at the bottom of the aorta. Other vessels that I want you to be familiar with right now are going to be the coronary arteries. We have the right coronary artery coming off here and running in a groove or sulcus between my atrium and my ventricle. That's called an atrioventricular sulcus. And again, that's my right coronary artery within there. It gives off a branch here called the marginal artery. And then my right coronary vessel, coronary artery, continues around to the back of the heart here, where it then gives off the posterior interventricular artery. I'm going to go back around to the front side of our heart and take a look at the left coronary artery. Now, the best way to see the left coronary artery is if we move the pulmonary trunk out of the way. So here's my pulmonary trunk. I move it out of the way. I see my aorta, and I can see that left coronary vessel coming off of the aorta. It goes behind the pulmonary trunk before it pops out right here and splits. As soon as it splits, we are going to rename each of the branches. The anterior interventricular artery, and then the one that goes around to the back will be the circumflex artery. Any of the blue structures on the external side of the heart are going to be cardiac veins, and that's true for both the front and the back of this heart, so some more cardiac veins. All the cardiac veins are going to drain into the coronary sinus, which we saw coming around here into the back of this chamber, which is my right atrium. We can see two pieces of the conduction system of the heart if we come into our right atrium here. The first is the SA node labeled 86. So that SA node is sitting right around about the spot that the superior vena cava enters that right atrium, so at the junction point between those, the SA node or the pacemaker of the heart. The other one that you can see is the atrioventricular node, and it's a little bit tougher to see. It's labeled 100. In the very bottom of that right atrium. It looks sort of like a little white spider in there. Again, that's the AV or atrioventricular node. The last thing that I want to point out while we have our heart model out is I want to point out some of the vessels that we'll be covering in our vessels lab. We named the big ones here. We named the superior vena cava, the aorta, and the pulmonary trunk. But let's name a couple of these other vessels that we can see here. That superior vena cava is formed by the fusion of two vessels, and that's the brachiocephalic vein on the right side and the brachiocephalic vein on the left side. They come together to create that superior vena cava. So where do the brachiocephalic veins come from? They come from the fusion of my internal jugular vein and my subclavian vein. So again, subclavian vein and internal jugular vein fuse together to make the brachiocephalic vein, which then fuses with the other brachiocephalic vein to make that superior vena cava. If there is an internal jugular vein, you better believe there's also an external jugular vein, and we can see it right here. Those vessels are going to be mirrored on the other side. So again, brachiocephalic vein, internal jugular vein, subclavian vein, and my external jugular vein. For the big arteries that are coming off the arch of the aorta, so here's my arch of the aorta. The first branch right here is the brachiocephalic artery, and remember that that brachiocephalic artery or brachiocephalic trunk only exists on the right side of the body. And it gives off two branches, our common carotid, our right common carotid artery, and then over here, our right subclavian artery. We also have a left common carotid and a left subclavian, but unlike these on the right side, they branch directly off the arch of the aorta. So here's that left common carotid artery, and here's that left subclavian artery.